Buenas and Hafa everyone. This virtual meeting of the Senior Citizens Housing Task Force is hereby called to order. For the record, today is Friday, March 18th, 2022, and the time now is 10:03 a.m. In accordance with open government law, notices for this meeting were sent on March 11th, 2022, and again on March 16, 2022. In addition, this hearing was noticed in the Guam Daily Post and on the Guam Legislature's website. Before we proceed with the discussion of items on our agenda, I'd like to first provide some general rules of conduct for all those in attendance. The conduct of this hearing shall be as follows of this meeting. All must abide by the rules of conduct and quality assurance. Please keep your video on at all times and have little interruptions and adequate lighting. All participants will be muted until they are called upon to speak. And when you are called upon to speak, please unmute yourself and speak directly into the microphone. Members of the task force wishing to speak can raise their hand or chat in the in-app feature to be recognized. During a vote on a motion, the committee will ask for a hand vote. And if there is any objection, please voice it by writing in the chat or turning on your microphone. Discussion shall be confined to the substance and nature of this agenda, which was published prior to the hearing in our open government notices. A personal inference as to the character or motive of any task force member or any guest is not permitted. Any violations of this general rule of conduct will result in removal from the meeting room. I'd like to welcome all of the task force members this morning and recognize my colleague, Senator Tello Taitigui, who is in attendance as well, joining us. Hafa everyone, and welcome to this virtual meeting, task force meeting for senior citizens housing. And for those who are here and watching at home, this task force was created by Public Law 35-140 with the purpose of assessing senior housing availability and needs. The task force is composed of government officials, community stakeholders, and housing experts, and is responsible for developing long-term solutions for Guam's aging population. Before we begin, I'd like to take a moment of silence to honor the late Mr. Ray Tapasnia for his dedication and contributions to this task force as our vice chairperson, who passed away a few days ago, and give our condolences to his family and to the Gora family as well. Thank you very much, everyone. And we do have now Mrs. Liz Napoli from Gora, who is filling the place of Mr. Tapasnia. This is our third task force meeting, and I'm happy to have everyone back again. We took a little break. We had some issues scheduling over the holidays and trying to get through session here in the legislature, but I'm sure everyone's ready to get back to work. So I thank you for your commitment and for being here today, everyone. I think we've seen in the last couple of months some issues arising in the cost of living, gas prices, rent, food. All of these discussions have been very prevalent in the news and among conversations with all of our families and friends. And so this is a task force that I know people are very interested in for us to address the housing needs, especially of our aging population. Okay, and where we are called on in this specific task force for us to present issues and to share our ideas for very long-term solutions. I know that Senator Tello is here today, probably because she introduced a bill recently to help us along with the senior citizens housing issue, a qualifying certificate program. So we can recognize her at some point down the line if she'd like to give us a briefing of what that bill is. So we'll begin now. I'll ask our staff here to take roll of members present. Aisha.
Senator Amanda Shelton.
Hafa
Ms. Charlene San Nicolas.
Hafa
Ms. Edith Pangilinan.
Hafa
Ms. Elizabeth Napoli.
Buenas.
Mrs. Diana Calvo, absent. Mrs. Lourdes Mendiola,
Half a day and Buenos Dias.
Ms. Melanie Mendiola,
Today, this is Antoinette representing Mendiola, Miss Mendiola.
Ms. Phyllis Leon Guerrero, Dr. Margaret Hattori Ujima.
Ms. Mossy, thank you very much, Aisha. Does the chair hear a motion to excuse members not present? Okay, a motion to excuse those who are not here. All right.
I'll second that, Senator.
Okay, thank you very much, Shar. Moved by Shar, Ms. Nicholas, to excuse members not present. Hearing no objections. Thank you. And I'd like to state for the record that we are still awaiting. Thank you. And seconded by Mrs. Pangilinan. Thank you very much. I'd like to state for the record that we are still waiting on two representatives for the task force, and that is a member from the Guam Association of Realtors appointed by Governor Lulian Guerrero. And I know she is still awaiting feedback from the Guam Association of Realtors, and a representative from the Guam Council on Senior Citizens, which I know has not fully been impaneled at this time. Okay, and just some housekeeping also, that Mr. Tapasnio was the vice chair, the co-chair of this task force, and I'd like to ask Mrs. Napoli if you in his place are willing to continue to serve as the vice chair.
Yes, senior citizen housing is a very important part of GORA, so I willingly take on what the late Ray Tapasna was doing on behalf of this task force.
Assiduous Masi, thank you very much, Mrs. Napoli. And now we'll move to ratify the minutes of our last meeting. Do I hear a motion to ratify our minutes from November 18th, 2021, which is found in the Google Drive folder provided to everyone?
Senator, I'll move to approve the minutes.
Thank you, Dr. Hattori. Is there a second?
I'll second, Senator.
Okay. Thank you, Mr. Nicholas. Hearing no objections. Motion carries. Thank you. Okay, we are now in old business of the task force. At our last meeting, we recommended that we look into developing goals for the work we will do for a master plan to be submitted at the end of our meetings. And so we did discuss the following task force goals. One, providing housing for our Manumku with stable and attractive communities through the maintenance, renovation, and modification of existing homes. Two, producing new housing that meets the needs of our Manumku while not detracting from existing neighborhoods. And three, providing affordable and diverse housing to meet the needs of low and moderate income senior citizens. In addition, during our discussion, we developed potential goals centered around the ideas of existing housing, new housing, and affordability, including providing housing appropriate to accommodate individuals with disabilities, elderly, as well as healthy aging individuals for physical and mobility needs, providing the appropriate workforce development to ensure healthy and quality aging by incorporating different healthcare providers who will be instrumental in this aspect, and establishing health and safety requirement guidelines for our Manumku living with in these housing that we'll be exploring. So would anyone like to pick up the discussion or add any additional goal before we solidify these? No? Okay, so anyone wanting to speak on the goals of the task force? All right, we'll move on to the next item, which was federal infrastructure investments in senior housing. And this was, I know, briefly discussed during our last meeting as Guam stands to receive significant funding from infrastructure investments from the federal government. We did discuss that there would be things to anticipate, and perhaps we can have an update from Gora or anyone in the task force who has any new information on federal infrastructure funding.
My apologies, but I don't have any information to share right now. I have to meet with my chief planner and the other departments to get an update, which I do have scheduled for next week.
Okay.
Before I can really speak of what's coming down the pike from HUD.
Okay, thank you very much. We will table that for discussion in our next meeting. Is there anyone else in the panel who has any infrastructure funding or federal funding updates?
Senator, just to clarify, this is regarding federal funding updates for housing, right? For the expansion of housing, just to be clear, right?
Yes, any infrastructure funding, but Shar, if you wanted to update us on anything else senior related that you may think is helpful for us to know, please go ahead.
Yeah, at this time, because it's on the housing, I know we do not have that type of funding. On the senior side, I can tell you that we do receive, Guam does receive formula funding, and we anticipate receiving the remaining formula funding in mid to late April of 2022, as we've been informed through our grantor through monthly check-in call. So the last update was back in February. And so that at least I can share with you. Thank you.
Thank you very much. Anyone else? Yes, Ms. Pangilinan.
If I may, Senator and members of the task force, we don't receive any federal funding as for housing needs, especially for the seniors. But we do have units that we rent out, and as I mentioned or stated in the last meeting, we do have seniors that are currently our tenants at our units in the 3 locations that we currently have, which is Lada, of course, and Sayani Legend and Satlis and Jigo. I want to thank the governor and lieutenant governor, because we were actually we sought financial help, and as a result of that, we were able to receive some funding. As you know, we also already started our renovations at Lada as of last month, so we're on point with the project as it's going on. But we are also GORA compliant in some of our units. So we also accept GORA vouchers for our units. So that's where we play a role in this housing for the senior citizens.
Okay, thank you very much. I think that was also a good update from you for the next item on our agenda, which is the new business in identification and assessment of current resources. So that is one of the existing resources that we have. We know seniors are utilizing the housing available. Okay. So on that note, I guess we'll continue with this item of the new business identification and assessment of current resources. If there's anything that any other task force member would like to share. If anyone wants to speak from their agency, what is available, or any service that they provide, or actual placements maybe.
Well, if I may, I am very well aware of what GORA housing programs there are, and for senior citizens and individuals with disabilities, right? So we do have, no one is able to apply for housing unless the wait lists are open. And with regard to Section 8 vouchers, the wait lists that are open at all times and just require referral from partnering agencies who have these individuals as their clients, such as Guam Behavioral Wellness, DISID, Catholic Social Services, etc. They can refer senior citizens for housing. We do have project-based vouchers for senior citizens. It's just a matter of people reaching out to us and letting us know, here is a senior citizen, would they be eligible, et cetera, and then we reach out to our partnering agencies to ask them to please refer these individuals for the housing programs that we do have available. I know that I see that the late Director Tapasna did provide senior housing data back in October, I believe, at one of the meetings. And I know that one of the things that, he also spoke about was the federal tax credits. And we recently, at a recent meeting, we have a LIHTC project that has been awarded. And, one of the things that we also try to speak to developers about is the possibility of having some of those units for individuals with disabilities is ensuring that there are ADA compliant units, at least a percentage of those properties have ADA compliant units. So the enforcement of that, I guess, is, I believe there is a law that has to do with that, requiring if they use the LIHTC funds, that a certain percentage of it is ADA compliant. So those are things that we try to make sure we look into when we do have these projects going up. But anyone can contact our office at any time. And I do get frequent calls from people regarding housing for seniors. And I must say that the biggest thing that I've been hearing recently is there are a lot of seniors out there who don't have family support and are left on their own and need caregiving. And, caregiving is really a big issue. They don't have the funds to pay for caregiving services that are available. Or they find out that they're not eligible for the caregiving services. And it just breaks my heart because I don't know how else to help them in that area. The caregiving is a big thing that they're always crying to me about, after they get housed or in order to maintain their housing, because GORA housing is really independent living. So, I know there have been talks about having a multi-purpose facility that has, assisted living in it. And also maybe like a daycare kind of facility for individuals with disabilities. Lou Mendiola knows, because I'm on the Guam Developmental Disabilities Council, that I've spoken of that is something that's, on the radar is there are many adults with disabilities who, their families are forced to quit their jobs or resign from their jobs, retire from their jobs because they have no one else to be able to stay at home to care for these individuals with disabilities because their disabilities are severe enough that someone trained has to be with them. So there are so many issues for the elderly and for the individuals with disabilities that I think a multi-purpose facility for those that cannot, don't qualify as independent living adults, whether they're seniors or individuals with disabilities, that's really something that we need to try to focus on getting something done on.
Okay, thank you very much. On that note, I'd like to ask Mr. Nicholas and perhaps Dean Hattori if you can speak to the resources for caregiving and what exists at this time so we know for our assessment.
If I may, I'm Charlene Nicholas. I'm the Senior Citizens Administrator with the Division of Senior Citizens. We do have some program fundings that provide supportive type of services. They are limited term supportive services. So one of them being our case management services, which is contracted with Health Services of the Pacific. The reason why I bring up case management is that they conduct assessments and reassessments of individuals who may be more frail and who may be in need of more supportive type of services as mentioned by Gora. So one of them being, if housing is needed and identified, they'd be the ones to help coordinate for those individuals 60 and older who are seeking public housing to see if they meet the requirements. So that, once again, is with Health Services of the Pacific through the Case Management Services Program. One of the things that the caseworkers do in their assessment is they assess if they are in need of in-home services, and that's more like personal care, homemaker, chore. Individuals who have been determined eligible through their assessment, they will then assess, and if they meet that criteria, they will then provide that service. Even at that is extremely limited, up to 400. So I do want to bring that up. So that's one component, the in-home services program. There are some elderly who live alone, who do not have family support. So one of the strengths, I think, of the chore services that they help to go and obtain, let's say, groceries that may be needed, pick up prescription medication for that individual who's not able to be mobilized and go out and obtain that service. So they also do some light housekeeping of that individual, that senior, and they do help those who are extremely frail with bathing. So I'm just giving some examples there. The other program we do have is the National Family Caregiver Support Program. That program itself is also limited. Guam does receive formula funding. So it's limited, and they're there to support caregivers who are 18 and older, caring for an individual with severe disability. It could be those caring for someone with Alzheimer's, neurological brain disorder. So the 18 and older caring for that senior who's got Alzheimer's. The other group are family members age 55 and older, caring for an individual with disabilities. And even at that, that's also capped. So part of the core services provided through the Caregiver program, which is also with Health Services of the Pacific, also include respite. Respite is a short term. It does need to be scheduled and, of course, assessed. They also have access to counseling, which includes support giver, monthly support giver sessions. And that's where caregivers are able to exchange some of their challenges and difficulties so that they can continue to support each other. So that's one of the components of this program. I do know that our agency at the Division of Senior Citizens is also continuing to advocate and work with our Medicaid office. So in case individuals may not be aware, the local Medicaid office has had some updates and changes. And the reason why I bring this up is they're able to expand on the in-home services side to provide more personal care type of services. So that's something that we're also looking at because as we also get formula funding, limited local funding, we're looking at the Medicaid to help in the expansion of the supportive services. And that's where we can provide that that need for those who are looking for more of in-home services. So this is what I have right now. And if anybody has any questions, please let me know. But yes, I agree with Mrs. Napoli. We don't have that funding that says we're going to pay 100% for a caregiver to be present. We do know that. That's why we do have these supportive services program to help in that area. So we appreciate you bringing that up, and as we all try to resolve and solve this together. So thank you.
Thank you very much. On the caregivers point, Dr. Hattori, did you want to chime in?
Oh, sure. Thanks. Actually, DSC and Gura, gave great. Charlene, that was really great. Your explanation of DSC and the wide range of services. And also, I'm so glad you brought up the limitations, the issue, I mean, you're aware, and of course, Senator Taitagui, is that it's a wide range of problems, and although there are services, they are limited. So at the university, and I know also GCC, we both have caregiver training programs, but on the UOG side, sometimes we're short of nursing faculty to train the caregivers. So we've recently added more faculty that can assist in that training. What an advantage that Guam has is that, unlike some other states, the employers on Guam have worked with the university and GCC and the other training programs to set up a formal caregiver training program that actually has a set curriculum. And they've been having their staff, as much as possible, have their staff go through a training on an annual basis. So you get an initial caregiver certification, and then you do an annual retraining. So I would like to say that the staff caregivers that HSP has and that Mayor's Council has, through DSC, are actually very highly trained individuals. And many states don't even require any kind of certification and don't require annual training. So I do have to say that Guam is way ahead on that. Our issue is the number of trained caregivers is still not enough. So we are working on that, and then also trying to train family members, because there are a lot of family members taking on that role and don't have the training for it. So, as COVID has slightly, improved, although, there are still risks, we do have a lab set up that will be opening to have family members come in, scheduled for hands-on training, because we know that that is a huge need, not just the caregivers that are hired, but also the family members that are assuming that, huge responsibility. And it's all just been, learn on your own, or, learn as you're caring for your mom or your dad, right? So we are working on offering those types of programs at no charge through the current grant funding that we have from the federal government through HRSA, which is Workforce Development for Geriatrics. So, but, thankfully for this task force, you've got in place looking at all, the wide range of options that we're going to need to have, including, I totally agree with Gura, initiatives like Senator Taitagui's, where we talk about actual facilities, and then some further support for DSC and their programs. Thanks. I hope that helps. Sorry.
Yes, absolutely. Thank you very much. Helps us to have a better understanding of what we are working with right now and some other issues that we have to address, in addition to just the housing, because we know that the whole discussion here is about taking care of our seniors, not just sheltering them, but ensuring that they have all of the services and the care that they need. So I really appreciate all of those updates. Is there anyone else who would like to discuss any current resources, whether it's a service that we're providing or housing that is available at this time? Yes, okay. Michelle from DSID, thank you.
Good morning, everyone. I just wanted to kind of continue the conversation with regards to the lack of, or the limited amount of resources when it comes to caregivers. DSID also, as you all know, we acquired the programs that were with Guam Behavioral, which is the CHP Personal Care Respite Care Program, as well as Care.Homes. And with that being said, it is at the capacity at the current time. And, we do know that there is a wait list for individuals, not only senior citizens, but, the gap that we've identified already is the age group from 18 to 59 that don't even fall into the category of senior citizens for individuals with disabilities. And it's a big gap that, kind of has gone to the wayside. So, that is something that we as a task force, I believe, should also consider, that resources are very limited for that age group. And although I know this is a senior citizens task force, I think that we need to look into the age group there that's really, really being at a disservice right now. And funding is always going to be an issue, but not just funding, but like the prior speaker said, it's the finding people to provide the service, right? So even with Catholic Social Services now and the programs we do have, they are struggling to keep some employees because of better pastures, greener pastures in different areas. So even with that, even if the funding was available, a little bit more funding, it would be difficult to bring in new clients without people to provide the service. So, I just wanted to reiterate that senior citizens, yes, but also the gaps with the age group that we deal with also on our end at DISID. Thank you.
Yes, thank you very much. I know that is also a big issue, and we're happy to have you from DISID representatives to be here today, as well as folks who additionally serve on the Developmental Disabilities Council who can bring that perspective for all of us. Yes, Ms. Liu?
Yes, thank you very much, Madam Chair. I just wanted to bring up also, and I appreciate everybody mentioning all what they did. Everything about what is lacking, and especially DISID Michelle about the gaps for the individuals with disabilities up to the age of 59. Also, I just wanted to mention that there is a gap currently for identifying resources for families that are transitioning their elderly loved ones from, let's say, from the hospital to a nursing home. Since, if everybody's working in the family, they wish to transition their family to a nursing home. Now, as we all know, the nursing home that's available is, I believe there's only one on Guam. So that's lacking. And if they have the resource, but in general, if you need to transition your family to a place that they need 24/7 care, and with all the limitations, what do we do? The family has to quit work. And it's even the respite care services, they're all very, very limited. The formula funding for, let's say, NFCSP, because their grant is based on formula, so they're not able to accept any more clients that really in dire need of these services. Not to mention the ongoing caregiving trainings that all the families need in order for them to help their family member with senior citizens and individuals with disabilities. So obviously everybody can identify that it's lack of funding. Maybe if the grant is changed to not go by a formula funding and just, accept people that needs the help, but, how do we do all that? I think one of our major concern here is how to make that plan and how to make it work. It's right now, people are on the waiting list, and even if they have the resource, people are on the waiting list if they don't have the resource to put their loved one in a facility. So what do we do? Do we still have to quit our jobs? I mean, that's what we've been doing now. And they need financial help, because when you take care of an elderly and they don't have the resources, so they tend to fall on the family members. And if they're not able to keep a job because they have to stay home and take care of their family that needs it, the senior citizens, the aging population, where do we go? I mean, it's just, we need to work on this like yesterday. I'm sorry to say, but I fall in that category, and I wish I can still continue to work, and I know I can still work, but I cannot. It's difficult in that situation. So I look forward to working with everybody in this task force, and identifying and looking for solutions. I'm willing to help. Thank you.
Thank you very much, Ms. Liu. Would anyone else like to chime in? on the current resources available. Okay, thank you. We'll move on to the next point, and that is the identification of new resources. So if there is, I know we talked a lot about existing programs and the limitations that we have with those and the importance of the expansion of what we already have. But if there's anything that you think that we're missing that we can add to this list of new resources as a policy recommendation or a recommendation for us to consider in the overall plan. Yes, Ms. Nicholas.
Hi, so I just want to share that also on this this call, the Zoom, I have our social services supervisor, one Evelyn Manabusan, with me joining. So some of the things we've explored from the last meeting is we're looking at personal care homes and ways to fund personal care homes. We've had a conference call this past week with
You're on mute.
Sorry, I took myself off mute. So we are looking to add that in personal care homes, and this will also help maybe with Ms. Menjola's point about what are we able to do. So one of the things that I had asked, or we had asked, is how do we assist those who are indigent? How are the funding being provided for these personal care homes? And so some of it was funded through the individual's Social Security, whatever retirement there may be, to fund these personal care home type of services. And for those that were indigent, meaning they do not have Social Security, other local state resources. So that's just something we're looking at. So we'll share that with you, Senator. We just received information, but I think that's an area that we can add on to, and it can help rather than having a large multi-facility. If we look at smaller homes and where they may be able to provide that type of need, as Ms. Menjola has brought up. But of course, if it's more specialized, we understand we need to look at that nursing level function type of care, but I do want to bring that up. So that was it.
Thank you very much. Anyone else? Okay, thank you. I'd like to also take recommendations at this time for any of these points on our new agenda items. If there are any folks that you think that we should invite into the discussion, I know that there may be other experts in the community that you would like to hear from, and we'd like to take recommendations of who to invite to our next task force discussion. All right, well, maybe everyone will still think about it and have some recommendations at the end. Oh, Ms. Liu, go ahead. Yes, please.
I strongly recommend a person representing Medicaid. I know that's under the Division of Senior Citizens, and also Medicare, because we need to know how can that funding help the individual in the housing area. Thank you.
Thank you very much. Okay, we will work with DSC to ensure that we have someone to join us.
If I could just clarify, Senator, the
Sure.
Medicaid office is not under the Division of Senior Citizens. It's under the Division of Public Welfare. Just want to clarify that we do not oversee that program at all. Okay, but we will work with you to provide a resource, whoever to join this. Thank you.
Okay, I appreciate it. Thank you so much, Shar. All right. The next topic actually is the viability of long-term insurance for our seniors and how this will affect housing and care needs. So if anyone would like to discuss this or bring up any points about insurance, I know this is one of the topics. Obviously, we've been asked to now invite a representative from Medicaid and Medicare, which I think will be very helpful. But if anyone would like to get the conversation going today. All right, thank you very much. So we'll table that and invite some experts to answer any questions that we have to the next discussion. Now, this is just the open floor portion. If anyone would like to bring up any potential items for our next agenda, our next meeting, which is tentatively scheduled for, just make sure I got it right, April 20th at 10 a.m. If there are any topics that you think we should focus on, please bring them up at this time and we can add them to the agenda. Okay, and I know that we have had this whole list of proposed goals for the task force, and there were more items added. If there are any other points that you'd like to add, I'd like for us to officially vote on those goals in the next meeting so that we can have a clear vision of what we're working toward together. So if you can all keep that in mind. Does anyone have any announcements or remarks?
Yes, if I could, we did put out a press release for those who are on this panel, and we have a press release out. We are looking for centenarians on Guam. I did share that with Senator Shelton, and if you can send it to those that are on this list. It is also under the Department of Public Health and Social Services website for any individual who will be 100 and or more between January to December of this year. Okay. So please let us know so we can honor these individuals. We know that our numbers, at least what we've looked at, it's increasing. So Margaret will be reaching out with you because this is going to be just amazing, at least if all do consent. So anybody out there, you do not have to be a US citizen so long as you're living here on Guam and have been residing on Guam. So that would be it. If you have any questions, just let us know, call our office. Thank you.
Thank you so much, Shar. Yes, I will send all of our task force members the press release that you sent out. I think this is one of the best events that the Division of Senior Citizens puts on every year. It's really a joy to see all of our centenarians. We've been doing it over Zoom the last couple of years, but I hope that it's something we can continue. Dr. Hattori?
Yes, I just wanted to mention and announce that we've partnered with GURA, and I want to really thank the director and for her collaboration. We're going to the GURA Ross housing areas. So we are going to Agate on Saturday to meet with their seniors, and tomorrow I'll be talking to them about fall risk assessment and fall prevention. So we'll actually be going over details about their personal abilities and their personal health to see what their risk is of falling in their own residences. But we're really thankful to GURA because they're allowing us to come once a month in March and April to the 4 different GURA Ross housing communities. And so I really do appreciate that partnership. And DSC has been wonderful. We've been sharing our monthly educational sessions with their families and their staff. So I really appreciate the people on this call because it's such a wonderful group of people dedicated to trying to improve the quality of life for our Manamco. So thank you.
Absolutely. Thank you so much, Dr. Hattori. I echo those same sentiments. I'm very grateful to have all of you in the same Zoom room for us to have these discussions monthly. I'd like to just invite Senator Taitigui if you wanted to say anything to the task force this morning before we close.
Well, thank you, Madam Chair, and definitely wanted to at least say thank you so much for everybody who's on this task force. A lot of the information that you're putting out is very helpful to the public. Many of them can't get through to get this kind of information, so it's very helpful. I've been working on this for about 3 months now, trying to find a solution to our aging population. And I introduced Bill 259, and it's also co-sponsored by Senator Shelton as well. And I'm hoping that with the work that you're doing, it's going to provide the support needed to push this bill through. And let the people of Guam realize that this is an issue. And, you know, our population is going to be, the majority of the people here, almost the majority, is going to be above the age of 65, coming shortly, like in 2035. So it's definitely something that we have to look into. And I greatly appreciate, Edith, all the information you provided I'll be taking notes because I get constituents who call our office a lot of times seeking help right now. And that's what I'm thinking this task force is doing and providing the support for Manamku now, today. What is available? What can we do today? Because Bill 259, it's going to take a while to get a developer to come to the island. And the bill requires not only a developer to come to build it, but also a managing company to manage the facility. The facility that I'm envisioning is not just for those who are indigent, but also for those who are middle class as well. The middle class seems to, at the end, they're going into their twilight years, they have to sell everything off in order to find some kind of help and assistance. They don't qualify, for certain public assistance because they make too much or they have other assets to their portfolio. So I want to reach out not just to those indigents, but the middle class as well. And this facility, I'm hoping it is a facility that provides first your independent living. Second, it phases in the same facility, it will phase in assistant living. And then as individuals get older, they then go into what's called nursing care. And staying in that same facility is very helpful. I visited 2 places in Hawaii in December. And I met with the coordinators there, the management company that oversee it out of Seattle. And then I also was able to get information from the developer himself. He has built 5 facilities in Hawaii that does just that. So a lot of times our Manamko here on Guam, they don't want to leave. When their children have left the island and they get to that age, they can't take care of themselves. Usually, the kids will say, okay, mom, dad, come to California, come to Washington and stay with us. And many of them don't want to do that. I know my father, he doesn't even want to go. He wants to live his twilight years out home in Guam where he's familiar with. This is home. He doesn't want to be uprooted. So a lot of times they don't want to go and they want to stay here. So this provides a place for them to stay. One of the biggest things, and I'll leave it at that because we can go on, and I greatly appreciate all the hard work you're doing, public health. Oh my gosh, amen to you. And when we go into budget time, we're going to focus on helping funding that scenario there, and all the other regulatory agencies, as well as most especially the nonprofit organizations. But lastly, there's a lot of work that needs to be done with this bill. And like I said, it's going to take some time. And I need your support, to be there to testify on this bill, the need, most especially the need for this. But today is a big problem. Like public health has mentioned, Margaret has mentioned, Edith, what is available today for our Manamku? And that's a challenge that I hope this task force continues to address. And I greatly appreciate all your hard work. Thank you so much for the opportunity, Madam Chair. And as well, please, my door is always open if there's anything I can do to help do your research or do some research for you or anything I can do. Thank you. Sorry, I'm long-winded on this. I'm very passionate about this. So
yes, thank you very much, Senator Teidig. We're appreciative of the update as well, and we will work to coordinate our efforts with your new bill. And as you know, that's why we impaneled this task force to address these issues. And so we hope to collaborate our efforts so that we can do the very best on all our parts to provide these services and to ensure the safety and security of our Manamku for years to come. So we really do appreciate it. I will keep the task force abreast of any movement for the bill, the next step, the public hearing process. I will do that. Thank you very much. And that is all for us today. And I'd like to thank all of you here. I just realized we're all women on this call, so I want to wish you all a happy International Women's Month. Thank you for being here and for serving with us on the Senior Citizens Housing Task Force, and also Biba Mesh Chamorro. Thank you very much, and we'll see you all again next month on April 20th at 10 a.m. We will send out an official notice for all of you. Seduas Masi, take care and be safe, everyone.